Welcome to your Medic Minute for September. This month and over the next couple months, I'm going to go over initial assessment and initial treatment of severely injured trauma patients. Medics in the military are kind of the experts when it comes to the kind of trauma we're going to be talking about. And in the military, for the initial assessment of trauma patients and for the initial treatment of trauma patients, they use an acronym called M.A.R.C.H. And this month, we're going to go over the first part of that assessment. So again, M.A.R.C.H is the acronym that the military uses for trauma assessment, initial trauma assessment, and initial trauma treatment. The M in M.A.R.C.H stands for massive hemorrhage, and that is the assessment and skill that we're going to cover this month. The A stands for airway, R is for respiratory, C is for circulation, and H is for hyperthermia. And we'll go over the other parts of this assessment in later videos, but this month we're going to cover massive hemorrhage.
This is a really good diagram to show you the different areas and what type of treatment you need to do on these different areas. As you can see, the areas in blue, the extremities, you'd put on a tourniquet. The areas in gray here, I guess, that's where you would do the wound packing in the junctional areas. And then in this, the box area or in the torso, that's where you would apply a chest seal.
So the first thing that you're going to do as you're approaching your trauma patient is look for any obvious life-threatening bleeding and address that bleeding accordingly. The first thing that you're going to do is apply direct pressure to that wound. And then from there, depending on where the injury is, will dictate how you're going to treat that further. So let's say that you have a brachial artery injury and you apply direct pressure and you're not stopping the bleeding with just direct pressure. That's when you're going to use your tourniquets on any one of your four extremities. So we put direct pressure on, we get out our tourniquets. I'm not going to go over these too much at length because we've trained on these a lot in CEs, but just a couple of take-home points. You take out your tourniquet, you put it on, try to put it on mid-muscle. Try not to put it too high up into like the armpit or the groin because you don't want to mess with those nerve areas too much. So try to put it right on the muscle if you can. Tighten it down until your windlass rod stops or the bleeding stops. You can use a secondary tourniquet if one tourniquet and direct pressure does not stop the bleeding. You can use two, just make sure you put it right up against the first one so we don't create any kind of compartment syndrome. If you have a penetrating injury to the head or neck, that's going to be a little bit different because we can't put a lot of direct pressure on those. So put as much pressure as you can without putting pressure on the trachea, in the neck area. Those are patients that we're going to want to prioritize transporting right away. Any kind of penetrating trauma to the chest area, I'm going to go over chest seals and occlusive dressings later, so I don't want to touch on that too much, but control that bleeding as much as you can with direct pressure. Now let's talk about when you have a penetrating trauma to a junctional area. So a shoulder or especially a hip or high thigh where you can't get a tourniquet on and you have severe bleeding from there. How are we going to address those issues? The main thing that we're going to do initially is apply direct pressure with just a standard bandage, and then we're going to get out our combat gauze and we are going to tightly pack the wound with our combat gauze. Combat gauze has a chemical in it called kaolin. That chemical binds with our natural body's clotting factors and helps clot off those major bleeds. So we're going to demonstrate how to properly pack a wound with combat gauze. Okay, so now we're going to go over how to properly pack a wound with combat gauze. So we're going to use our little simulator. Let's say you arrive on scene and your patient has been shot. You got a nice little entry wound there, entry or exit wound. And as you walk up to the patient, let's say that this is in the upper thigh area where you can't get a tourniquet on it. And this is what you're seeing spurting out of the patient, okay? So the first thing that you want to do is immediately apply direct pressure over the wound. Obviously, this is going to cause the patient a lot of pain, but we need to stop that bleeding. Second thing you're going to do is get out your combat gauze. I've already been kind of playing with this one. So when you open this up, it's going to be Z-packed, so it'll be basically Z-folded. You're going to pull out the tip of your gauze, and you are going to start packing that gauze as deep into that wound. You are actually shoving that gauze deep, deep, deep into that wound to let that chemical get up against that artery and stop that bleeding. Now, let's say that you get all finished and you've used all your combat gauze, but your wound is still partially open, or you still have room left in that wound. That's when you would grab your sterile cling and go ahead and, excuse me, and continue to pack that wound with your sterile cling. When you're using your combat gauze, you want to maintain pressure and then bandage for at least 3 minutes. If you don't have combat gauze on hand and all you have is cling, you pack the wound exactly the same as you would with combat gauze, but you have to maintain direct pressure for at least 10 minutes. Okay, so just keep that in mind. Once you get your wound fully packed, then you will take another dressing, whether it's a multi-trauma dressing or an abdominal pad, and put that over, and then dress your wound, and then get that patient to the destination. So again, that's just the first step in the M.A.R.C.H assessment and initial treatment of a trauma patient. I hope this video was helpful. Next month, we're going to go over the next step in the M.A.R.C.H trauma assessment, which is airway.